So I think traditionally patients have waited a long time on a secondary care waiting list to come and see a consultant face to face and tell their story and have some treatment or investigations. But we felt perhaps that consultants could offer a better service, could deploy their expertise in a slightly different way. So obviously we spend a lot of time managing patients in the outpatient setting as well as inpatients, and I think the problem we were finding with the outpatients was that they were often having to wait a long time to get specialist advice in hospitals, but because of the pressures on the system they were often having to wait very many weeks or months usually to see us. And we felt that we could be doing better in terms of timeliness and getting them some proper treatment and advice more quickly. So the first thing really was to try and build as many lines of communication with GPs as possible. And then really what we did is try and move very quickly to a robust advice and guidance model. And this is where GPs could send us an email or a communication, and rather than expect a long wait for an outpatient appointment, we could offer very quick advice in 24 or 48 hours rather than weeks or months. So that's really what we've been looking at over the last few years, how we can offer specialist advice and treatment to patients in a more timely fashion.
I actually think this has been a success really from multiple ways. The first thing is we started advice and guidance, it's gone across all departments, but Gastro stood out, I think, from a GP perspective as giving really bespoke, useful advice back. And so we were on a bit of a positive cycle of good response, helpful, encouraging. So that was great in itself, and I think the department really bought into it. And then we've got, 2 or 3 key clinicians and some really good managers that have kind of grabbed this, said, what are the opportunities, how do we move this forward? You've got Matt, you've got Richard Thompson, a whole load of others, where it's just a really good department to engage with, and I think it's gathered its own momentum. When it works well, it's really enabling because you get an answer back as a GP or as a patient really quickly, and what we've certainly seen is that means that where patients do need to be seen, they're seen really quickly. And also being able to say to others, I've actually discussed your results, I've discussed this with a consultant, they're happy, doesn't need any further action, is quite empowering both for you as a GP, because it often backs up what your gut feeling is, but you kind of just need that extra bit of support to actually confirm that. But it's also great for patients because they know that they're actually getting a very fast resolution to things, and that often de-escalates situations where otherwise people are just pondering, they're worrying, and actually the more sometimes people think about the symptoms, the more that can expand, and you actually end up not just with one problem but a whole series, and I think that can be quite powerful.
So I think I have quite sort of high aspirations for this really. I feel very aware that the health of the population is perhaps not where we want it to be, and some part of that is to do with waiting lists. And I guess what I hoped is that if we could look across the organisation to reduce waiting lists, we might start to see some beneficial effects in primary care and giving them more time to deal with their patients, maybe fewer patients ending up in A&E. I know this is all quite sort of aspirational, if you like, but I hoped that we could have a benefit to the wider health economy and the health of our population really.